your turnout, guys. Yeah. Okay. Anyway, what are we talking about today? Totally forget. We're talking about SLE. Yeah, it's going to be great. We've got a treat for you today. I've got Brenda. She's coming in to talk about having SLE and all the things that entails. We couldn't get Seal, but we tried.
Audio Jungle. Audio Jungle.
I've had systemic lupus erythematosus for about 5 years now. It all started when I had some weird signs and symptoms, so I went along to my GP and he referred me to a rheumatologist who conducted a bunch of diagnostic tests, and in the end he diagnosed me with SLE. So I began taking medications, and over the years I've had some relapses which have landed me in hospital a couple of times, but at the moment I'm doing pretty well. So does anyone have any questions?
So, what even made you go to the doctor in the first place?
There were certain changes in my body. It felt like everything was attacking itself.
Ow!
What the hell?
Maybe I was talking to anybody.
I wasn't go.
I didn't feel so good.
Yeah, I feel really hot. Does anyone else feel really hot? No. It's really bright in here. I can't see. Is anyone got any sunnies?
Oh yeah.
Suck it up.
Ouch. Yeah.
Has anybody seen my red blood cells?
No. What do you mean?
I can't find them.
Look, you're not getting any more from me.
Why not?
I'm in pain. My joints are stiff. They're sore. Check that out. You're not getting any.
I'm anemic.
Skin, what's all over you? I don't know. It's really itchy and sore. It's on my nose, my face, my shoulders. Some sort of rash. It looks like a butterfly. Why hasn't it affected you? I don't know why you guys are all weird. I feel great.
Yeah, but what's that mark?
Oh my god! What is that? I can't even feel it. And there's another one. Oh my god, I've got mucosal ulcerations everywhere. Ah!
So basically I kept on getting recurrent rashes. My skin was itchy and it felt hot. When I was out in the sun, it was even worse. They call this photosensitivity. My bones felt brittle and my mouth started to ulcerate. It was scary, so I went and got it checked out.
So what were the specific diagnostic tests that you had to have done? Okay, Brenda, so the next step would be to do some blood tests. This would be to testing whether you are anemic at the moment or not, and have a look at your different organs to see whether they've been infected. So I'm just going to get my assistant in now to do a blood sample. Thank you. Yeah, come in. Great, so while he's doing that, I'm just going to go through a bit more of the other tests. So we'll also want to collect a urine sample. So this will examine if there's any protein levels or red blood cells, which the SLE can affect your kidneys, and that will be recognised in that. And we'll also test for any antibodies, called in particular antinuclear, which is the ANA test. And if that comes back positive, we'll do some further antibody tests. Okay. We'll also do a test for syphilis, because if that comes back negative positive, it is a good indication that there is an immune system condition, which could be SLE. So if we're not satisfied by those, we'll go on further and do an X-ray of your chest to see if there's any inflammation or fluid in your lungs. And if further last resorts, we would do a biopsy.
Okay. As nurses, what we can do for Brenda? My name is Yuri. I'm just here to let you know a few things before you go.
Okay.
About your discharge planning. And then firstly, about your skins. As you are aware, you are really having sensitive skin. I want you to always wear the sunscreen and the long sleeves hat and sunglasses. And then any problem arise, please let us know. And it's really important that you looking after yourself, doing your self-monitoring. So any skin rashes persist, any redness, you haven't seen it for a long time, you have to get back to us as soon as possible. Are you aware of what medication you are on, right?
Yeah.
For the skins?
Yeah, I am.
And secondly, for your mouth ulcers, and I would strongly recommend just eat soft food, and then always using the lip balm, try to avoid any dryness. And then if you feel you're getting any itchiness inside your mouth, just clean with your normal saline. Yeah, that really helps. And I have referred you to some support group. It's called Notre Dame Lupus Social Club. So you can just go out and then talk about with the people who've been experiencing problem. It might be helping.
That sounds good.
Yeah. Okay. For about your pain on your joint and muscle, I also have referred you to the Notre Dame physio therapist. So go and have a look, have a chat. They will probably provide you with exercises helping you reducing your swelling and then inflammation on your joint.
Okay.
But I really wanted to not to bear any weight because you have a very inflammation on your joint.
Okay.
So, and try to overdo exercise, and then if you feel unwell when you're on doing outing, please just, you have to always see how tired you are.
Alright.
So, okay. So last, I want to mention about your anemia. You know about the symptom of your anemia. So, dizziness or difficulty of concentrating on doing anything, just self-recognize yourself.
Yeah.
And then stop what you're doing, and then have a rest, and then drink plenty of water first, and then don't make any symptom getting worse.
Okay.
Okay? Alright. Yeah, I'm happy to let you go. Your skin looks really, really better.
Yeah.
Yeah. Okay, all the best.
Thank you.
I see you again.
Hope not.
Hope not. Okay, bye-bye.
So now that you've been diagnosed with SLE, does that put you at a higher risk of developing anything else? Brenda, due to her SLE, is at a heightened risk of obtaining cardiovascular disorders, including atherosclerotic buildups and pericarditis. She's more prone to infections due to a suppressed immune system. Lupus nephritis occurs in people suffering from SLE as it enables similar inflammatory process to target the kidney, causing the glomerular vessels that filter the waste in kidneys to become inflamed. Lupus nephritis is diagnosed through presence of hematuria, protein and cholesterol levels, kidney biopsy and glomerular filtration rate. We advise Brenda to stay away from these risk factors as much as possible, meaning to stay out of the sun or wear sun protection, stay hydrated at all times, try to avoid contraceptive agents like the pill as it is closely associated with antiphospholipid antibody syndrome and is at heightened risk of forming blood clots. It is important for Brenda to look after her well-being, stay rested and be aware of the pressure she puts her body under and how much it can affect her in the future.
So just because we haven't covered this yet, other than that little problem you had, what did the doctor say to take for medication?
Hi Brenda, how are you today?
I'm alright.
Yeah, not too well being in hospital?
No.
Well, I'm the pharmacist. The nurse and doctor will come in later to have a chat to you. We're just going to talk about the drugs that you'll be on with your SLE. So as you know, there is no cure for lupus, but these drugs will help alleviate the symptoms. So COX-2 inhibitors are going to help relieve the fever and inflammation. You will need to be aware of any complications that occur with those, including constipation. And if you experience any of these, please make the doctor aware as soon as possible and stop taking the drug. So Brenda, you'll also be on an antimalarial to target your rashes and mouth ulcers. But if you are experiencing cramps, headaches, and lightheadedness, then we'll have to think about the dose that you're on. We'll start with a smaller dose and then build you up to a bigger one because these can be quite aggressive medications. These corticosteroids are aimed primarily at reducing your joint pain and swelling. You need to be aware that this can cause brittle bones, diabetes and heart disease, if it all comes to worse. At this stage, we are not placing you on immunosuppressants due to their complications, but if you were to develop any serious complications or not respond to this treatment, we will place you on a immunosuppressant. Yeah, we'll be placing you on immunosuppressant if need be. So that's it from me. If you have any questions about the medications, please don't hesitate to ask, and we'll send the doctor and nurse and just have a bit more of a chat with you.
Thank you.
No worries, Brenda.
Alright, so thanks for coming and listening to me today, guys. I hope you learnt a lot. We've spoke a lot about the physical signs and symptoms and the physical things I did to relieve those of SLE, but we didn't speak about the psychological, and so I've been seeing my counsellor recently, and with the support of family and friends and following the day-to-day guidelines set by my doctor, I've been able to reduce a lot of my symptoms, and it's been good for my psychological health to do that. So thanks.
Great, thank you.
Yeah.